What's up, guys? Let's talk about what to wear to a nursing job interview. All right, I've seen a lot of things in interview situations, a lot of good choices, a lot of perfectly fine choices, and a lot of regrettable choices. Now, here's a caveat with this. Is your outfit gonna make or break your interview? Not necessarily. So if you come in and don't look as put together, but you nail the interview, I can't say that outfit is gonna discount you from the job. Conversely, if you come in looking perfect and you interview horribly, that outfit's not gonna make up for it, okay? Important to know that. But if you come in and you look very disheveled and you're kind of in the middle, it's not gonna help you, all right? So let's go through some considerations when you go into a nursing job interview situation. Number one, don't you come in scrubs, y'all. This is not a time to wear scrubs. Even if they're like figs nice and all like ironed in a little cute joggers and you got the best shoes and what, don't do that. I've seen people not only come in scrubs with very messy hair, look very disheveled, like they didn't even try to look presentable. That looks awful, okay? This is a professional environment. Even if you're just graduating nursing school and you're, kind of younger and you've never been in a super professional environment before, this is it. Don't come in those scrubs. All right, next. I want you to remember your purpose here. It is not to look super fashionable. It's not to look really, really cute and adorable or really sleek. You want to present yourself as a professional, capable person, okay? So I don't want you stressing over, oh, these shoes are cuter than these, or this top is cuter and it accents whatever. The purpose of this is to really speak to your professional expertise and what you can offer clinically. And those little details of what's cuter and what accents this better, like this isn't a fashion interview. This isn't even something like graphic design. This is a clinical situation where you want to be someone where you walk in the room and it's like, I would trust this person with my loved ones, okay? So when you're considering, should I wear this or that, know that if you are covered up, if you are look like you put some time into this and you care about the way that you look, that's going to be the most important thing. So I've had people say, women say to me, you know what, I hate makeup and I don't like wearing makeup. Do I need to wear makeup for this? My answer is you don't actually have to, but I really want you to make sure that your outfit looks put together. Your hair looks, however you do your hair, you've done it. You're not wearing a hat. You're not wearing a hoodie or anything like that. You put some time and purpose into how you're presenting yourself. Okay, I would much rather have I would get a much better impression from someone. They're not wearing makeup, but their hair looks pretty good, or their hair looks put together and combed and groomed, and their outfit looks clean and it looks appropriate versus someone who's kind of like way overdone and can't really speak though to their own clinical skills, right? Like keep those things in mind. So if you're going for an entry-level nursing position, typically things that look great are slacks that fit well, that are ironed and don't have a ton of wrinkles, or a skirt, a longer skirt, one where if I sat down in front of you, if I can see your underwear, it's too short. I have seen that happen. Sitting down in an interview across from a young woman, very short skirt, very high heels, and I can see her neon underwear with her legs, with her sitting with her legs together. Don't do that. That is incredibly distracting to whatever message you're trying to convey, okay? Doesn't look so hot. More conservative in that kind of situation, the better. The last thing we want to do is pull focus from the fantastic clinical skill that you're bringing to the table, okay? So entry level, again, the slacks, the skirt, having a nice shirt that fits well. You got it's not all wrinkly, okay? Again, it doesn't need to be the most fashionable, most expensive. It needs to fit well. I need to not see your chest between the buttons, right? I want to be able, like, you look comfortable in your own skin. I don't want you to worry about, do I wear a blazer or not? The way I kind of quantify it is, if you've got one and it feels good, it fits great, it looks good, by all means you can wear that. But generally speaking, in nursing, nursing is not law, finance. It's a little different. There's business professional and business casual. Now, if you're interviewing for a nurse leadership position, a manager, a director, those higher level positions, probably even a nurse practitioner, anything that requires an advanced degree, I'd wear a blazer, okay? I'd wear a suit that looks and feels good. But if you're entry-level nurse and you've got on a nice outfit, I would not stress about getting a blazer, okay? I think that might be a little unnecessary. Now, if you have it, wonderful, but I wouldn't go drop $200 on a suit and then get it altered for this interview. I would have a nice fitting outfit that you feel comfortable in for this professional setting. So I'm not going to go through like, yes, wear this, don't wear that. Consider how you look in a professional setting. Again, it has to fit. This is not a time to look sexually attractive. Okay, that's not the purpose of this. So if you're wearing the really short skirt, the really high heels, the incredibly tight shirt with cleavage, or maybe unbuttoned like a shirt here, this is not the venue for that, and it's going to take away from the focus of whatever information you're trying to provide about your clinical expertise, okay? So I think that if you can have that in your mind, all those little details of, well, should I wear brown or black? Please just put some time into your appearance, groom your hair, make sure you don't have wrinkles, make sure everything fits, and it's not skin tight, and you're not swimming in it either. So I hope that helps make sense. The simpler, the better. I wouldn't go crazy with big jewelry and huge bright colors and things. Not that that's terrible, but again, we don't want distractions. We want to focus on the message you're trying to convey, and that's, hey, I'm a safe nurse that's reliable, and sometimes that means presenting yourself not quite as exciting or like perfectly fashionable, but just appropriate for the situation. So I hope that helps make sense and makes picking your outfit for these various interviews a little bit smoother and takes away a little bit of stress. I actually have a nursing interviews and resumes course. I'll put a link to it in the description where I go over more about outfits and things to wear and not wear, as well as how to navigate that interview, what a good interview sounds like and what a bad interview sound like, and the very subtle differences between the two. So if you want to check that out, there is a link to that in the description of this video. Thanks, guys.